There are two types of pressurized metered dose inhalers: the conventional pressurized metered dose inhalers and the soft mist inhalers. Pressurized metered dose inhalers and dry powder inhalers are medical devices that deliver inhaled medicines in an aerosol form. Each inhaler delivers a dose which is associated with each actuation of the inhaler upon a single inspiration by the patient. Each inhaler will contain a specified number of doses, which is used by a single patient until all the medication is depleted. These inhalers must meet standards set out by the FDA Center for Drug Evaluation Research in order to be approved for use. There are a variety of inhalers designs on the market and are typically available as a single inhaler form. Both types of these inhalers will require different instructions, and as such, failure to comply with these instructions will result in suboptimal therapy. Both the pressurized metered dose inhaler, the conventional type, and the soft mist inhaler are considered self-contained aerosol devices that have a basic composition that will include one, the canister that contains the drug and the excipients, the propellant, which is actually liquefied compressed gases in which the drug is dissolved or suspended. Popular propellants used are hydrofluoroalkanes. Additionally, instead of hydrofluoroalkanes, compressed gases like carbon dioxide, nitrogen, and nitrous oxide are also used as alternatives. You also have the valve assembly and metering chamber, the actuator, which activates and directs drug formulation and facilitates aerosolization and serves as the mouthpieces for several inhalers. You also have the drug formulation or the medication solution, which will include the drug and the excipients. And you have the dose counter from some of the inhalers. Not all, but some inhalers will provide a visual tracking of the number of doses remaining through this dose counter. Pressurized metered dose inhalers provide many advantages. One, it's compact. Two, easy to carry around, fairly easy to use, provides multi-dose convenience in a single device. It also delivers precise, repeatable doses. One important thing is that it requires short treatment time with no drug preparation required. And so, because there's no drug preparation required, it reduces the risk of contamination. This type of inhaler has disadvantages as well. One being that the patient will need to have hand-breath coordination and will need to activate the device before use. So this type of device will need priming before use. There needs to be proper inhalation pattern, and the patient may need to hold their breath to ensure that the dose is delivered effectively. Because the dose is fixed, it is difficult to adjust dosing. There is also a lot of oropharyngeal deposition, and patients may react to the propellant used in some of these devices. So the conventional pressurized metered dose inhaler is the most familiar type of inhaler that's available on the market. This is a press and breathe design. It works by having the patient shake the inhaler first, prime the device by spraying a few sprays into the air if used for the first time, or if it has not been in use. This is important as it ensures the correct amount of drug to be delivered. The patient then presses down on the canister into the actuator. This releases a drug propellant mixture that will expand and vaporizes, causing the liquid medication to form an aerosol. It then passes through the metering valve as the canister presses down and causes the hole in the metering valve to align with the metering chamber. It is through this hole that the drug propellant mixture is forced through as a pre-measured dose of the medication through the opening and through the actuator nozzle. The propellant, once exposed to the atmospheric pressure, then is rapidly volatilized after an actuation, leaving behind a liquid or a solid aerosol cloud that is then inspired or inhaled by the patient. Once the patient releases the canister, it also releases the metering valve, which refills the chambers with another dose of the drug propellant mixture. One actuation may provide between 50 micrograms to 5 milligrams of drug, depending on the formulation. A spacer is an accessory that is used with pressurized metered dose inhalers, and it is used to ensure comparable inhaled dose and clinical outcome to using the device alone. Essentially, the spacer adds extra volume, which decelerates the aerosol speed from the device, enabling a reduction in the particle size for improved delivery, provided, of course, that the device is used correctly. Proper usage should minimize oropharyngeal deposition, but unfortunately, it offers minimal assistance with poor hand-breath coordination required for effective delivery. Effective inhalation coordination should precede the actuation of the inhaler for optimal results. A well-fitted spacer and device are crucial for delivering an effective dose. Thus, each design will vary, and health professionals should consider this before selecting a spacer for a patient. Of course, as you would imagine, a spacer is mostly used by children and individuals who will have difficulty coordinating their breathing with the inhaler device. Okay, so let's look at soft mist inhalers. These inhalers are also known as the Respimat inhaler. They are propellant-free and they produce a soft mist upon actuation. It is a handheld inhaler with a hinged cap that is similar in size to the conventional pressurized metered dose inhalers. While it needs to be primed before it is used, if it's new or if it's left lying around for an extended period of time, just like conventional pressurized metered dose inhalers, it's not necessary to shake it, and it should not be used with a spacer. Now, the medication is housed in the drug cartridge in liquid or solution form, and this solution typically lacks a propellant, as I said earlier, but is commonly composed of either ethanol or water. It may contain benzalkonium chloride or EDTA as preservatives. Many devices are equipped with a dose indicator to estimate the remaining dose. So as a patient takes a dose, they will be able to estimate how many doses are left. To administer the medication, though, the patient needs to twist the base of the device, maybe about 180 degrees, compressing a spring that provides the mechanical power that would be required to aerosolize the dose of medication. This action transfers a metered dose of medication, usually about 10 to 15 microliters, from the drug cartridge through a capillary tube to the dosing chamber. Upon pushing the dose-related button, the mechanical energy from the spring propels the metered medication solution through channels in the uniblock. And this process generates two fine liquid jets at the outlet that converge at a predetermined angle to create an aerosol cloud containing fine particle fractions, usually about less than 5.8 micrometers, which is twice as high as most conventional pressurized metered dose inhalers and dry powder inhalers. And this design is believed to facilitate a higher proportion of drug being delivered to the lungs and less to the oropharynx, which makes it more efficient when you compare it to conventional metered dose inhalers.
Numerous factors impact the performance of pressurized, metered dose inhalers and aerosol drug delivery. It's crucial for us to grasp how the effect of these factors can notably enhance the effectiveness of these devices when administered to patients with pulmonary diseases. Today, we will delve into this topic and demystify the key factors that come into play. The performance of a metered dose inhaler, or MDI, can be influenced by a variety of factors. Let's begin with the first one, shaking the canister. Shaking is essential because it helps to homogenize the drug particles with the propellant and refilling of the metering valve with the next dose from the canister. Without adequate shaking, the drug delivery may not be consistent, leading to less effective treatment. Next, we have priming the device. Priming is the process of releasing 1 or 2 sprays into the air before using the inhaler for the first time, or if it has not been used for a while. This ensures that the right dose of medication is ready for delivery. An unprimed device might not deliver the correct dose, which could affect the efficacy of the treatment. Next, let's discuss storage temperature. Both extreme cold and heat can affect the performance of the MDI. Cold temperatures can reduce the pressure inside the canister, affecting the spray mechanism. On the other hand, high temperatures can cause the canister to burst. Therefore, it is crucial to store the inhaler at room temperature to ensure optimal performance. Nozzle size and cleanliness also play a significant role. White and crusty residue due to crystallization of medication may affect drug delivery, leading to a reduced dose. Hence, should be cleaned according to the manufacturer's recommendations. The timing of actuation intervals is another critical factor. The rapid actuation of more than 2 puffs may reduce drug delivery due to turbulence and the coalescence of particles. If the intervals between actuations are too short, the canister may not have enough time to refill with the drug, and the subsequent dose may be smaller. Therefore, it is important to wait at least 30 seconds between actuations. The characteristics of the patient, such as their ability to coordinate and their inhalation technique, can also affect the performance of the MDI. Proper education and training can help improve these aspects. Lastly, the breathing techniques used by the patient can greatly influence the drug delivery. Slow and deep inhalations, followed by a brief breath hold, allow the medication to reach deep into the lungs, ensuring maximum effectiveness. In summary, the performance of a metered dose inhaler can be influenced by factors such as shaking the canister, priming the device, storage temperature, nozzle size and cleanliness, timing of actuation intervals, patient characteristics, and breathing techniques. Understanding these factors can help healthcare professionals provide better guidance to patients, ultimately leading to more effective treatment outcomes. Remember, every detail matters when it comes to optimizing inhaler performance and drug delivery.